humanitarian situation in Somalia today remains catastrophic, particularly in the areas outside of Mogadishu. Today there's in excess of 250,000 displaced persons living in absolutely precarious conditions, with limited access to water, irregular food distributions, and limited access to health care in an extremely insecure environment where there is conflict more or less on a daily basis. The first few weeks of 2009 has seen the start of withdrawal of Ethiopian troops from Somalia. The context we expect to change considerably again during 2009, which will pose more problems for the Somalia population and for MSF to address their needs. In 2008, we witnessed a huge increase in the number of nutrition cases, especially in the areas around outside of Mogadishu, Hawa Abdi, Afgoi. We went from several hundred patients up to over 4,000 by the end of 2008, and we don't see any improvement in that situation in 2009. Furthermore, in the other locations in Dinzor and in Beledweyne, we also saw some peaks of nutritional cases, but not as severe as the situation that we've witnessed in the Afgoi Hawa Abdi area. It's approaching 1 year now that we have not been able to send international staff on a permanent basis to the field projects. So during that time, it's our national staff who have been running the projects in the field, but very closely supported by the coordination team in Nairobi, by the headquarters here in Geneva as well. It's been a process of learning this new way of working for MSF in Somalia. During 2008, we were able to visit the projects with some international staff, but just for a very, very short duration. And it was very impressive to see that the national staff were continuing to run the activities at a very, very good level.
The general impression after all these months without visiting the field, hospital is running well, is running smoothly. The main challenge is in the management in general. Management of pharmacy, which has been a little bit more difficult to keep the track or to follow for consumptions, for the drugs, for the storage. In medical terms, I think the project is being managed well, and the programs, the different programs that we run here, TV, maternity, things are going well. There was something we were offering before to the population, is the opportunity to have emergency surgical. That we have to stop that, and because it's really difficult now to refer patients to Mogadishu because of distance, because of security on the road, and also the quality of the transportation means. Been told by the staff that even patients, sometimes they say, okay, why we will go if we are going to die probably on the road? We prefer to stay here and to at least have a chance to get some attention, and that's putting a little bit of pressure on the staff.
And we must always remember as well that the national staff are living in Somalia in very, very difficult context. It's amazing what they are doing for MSF Swiss, and for the Somali people. For 2009, we are not planning to make any major changes to the activities that are currently running in Somalia. It's very much going to be a period of consolidating this new way of management, of reinforcing the national staff, supporting them as much as possible. But what we would like is that if the context and the security allows, that we can get international staff back into the field to support the national staff who have been doing such an amazing job for MSF over the last 12 months.